let people jump in as they need to. So, Tom, did you have anything to start off, or?
No, just welcome everybody. Glad to see so many people on. James has some things he wanted to talk about with our state updates, and then if you guys got the agenda from Katie yesterday, we'll just have you guys share kind of some of your work that you're working on, your implementation, things like that, any successes or barriers that you're seeing with the SOR grant. So yeah, good to have so many people on.
Awesome. Okay, so we just have a few updates from the state side of things, and I just want to encourage you, if you have any questions, just jump in, add them in the chat, raise your hand, whatever is easiest for you. But the first thing I wanted to start off with is, we've received feedback about Daterra being difficult to store. So as a drug deactivation item, that it takes up a lot of space, that pharmacies have issues with it as well, of the storage. And thanks to our partners at the One program, and I know that I saw Mark jump on. So Mark, if you have anything to add, I'll let you jump in at the end here. But we are pursuing an option to purchase these Dispose RX packets that are an alternative to Daterra. And so we will still, on the state side, do orders for Daterra. So we're not going to stop ordering that. We won't stop supplying you with Daterra if it's something that you need in your community. But we are looking at adding the option to also be able to supply you with this Dispose RX. Our state team had a meeting a couple of weeks ago with a vendor for this, and we were able to get a sample pack of the Dispose RX, and it's, just want to show you, here's the size of the Dispose RX packet. So it is way smaller, way easier to store, very convenient. And the way that this works is you take a pill bottle, you add some water to it. So you have the pills in there, add some water, dump the packet in, shake it up, and it will do its drug deactivation piece. And I'll let Mark speak to that if you would like to, if you have more specific questions about how it works. So then what it does is it deactivates the actual substance and it turns it into this goop. Try to get it out here. So it's actually like a slime. So it turns the pills into this slime, but it also deactivates them. So it works for illicit substances as well. So it doesn't just have to be used for prescription medications. It could be for other things as well. But we are on the state side working through our procurement processes to have them added as an approved vendor so that we can purchase the Dispose RX. And I think in the coming weeks, we will get a hold of you guys just to see if this is something you would like, and if you would, how many of these packets you'd like, and we'll hopefully get our initial order off pretty soon. So we're just in that phase of getting everything approved for us to actually make the purchase. So just wanted to bring that up so that you know one of the things that'll be upcoming hopefully soon. So that is the Dispose RX. And does anyone have any questions? Hook me up with a case. All right. Yes, we will, Michael. We will definitely help you guys. Go ahead.
This is Karen, and I was just going to say, I think it was last year my husband had surgery down in Arizona, and when we picked up his pain prescription, they had stapled a packet similar to that. It wasn't exactly that, but it was stapled to his prescription, and that's what it was for, was to dispose of it. And it is, it's just a little packet, and it's just very easy to use. I would guess, though, that we'd still need the Daterra bags because of, you know, the patches and things like that we would want to use that for, so that we're not handling that and sticking it into a container to sprinkle that in with, but just a thought.
good thought. There's a couple comments there, James, in the.
Yeah. So, Shannon, I see the shelf life. That's something that we can get back to you on, what the shelf life is, if there is one. So I'll get back to you on that. And then what type of container should be used for illicit substances. I think also we could get back to you on that if there is recommendations by the vendor of how to use, I'm not sure if they will have a recommendation or not, but I would think they would, since they indicate it's able to be used for illicit substances as well. So those are things that we can follow back up with you guys on.
I'm assuming this is bad, but you would just throw the whole bottle away, right? They don't want you to dump that in anything else. So I like the deterra because it was kind of a green bag and made it a little easier, but I understand.
Yes, and like I said, we will continue to order the deterra. That's still an option. But yes, the recommendation is throwing it in the trash after you deactivate it. Perfect. Right. So like I said, something, if you are able to work with a local pharmacy to carry this, that's definitely an option. And that's something, we'll probably work a little bit with the one program as well to see, where are their opportunities so that we don't double up efforts. And then we could communicate that to you as well, just so that, the work that you're doing isn't duplicative of what the one program is doing.
James, I have another question. This is Bev. Since that packet's so small, is it easily readable, or do what we have to put a postcard or something else attached to it on proper use?
Yeah, we would probably, there is actually instructions on the back. So it wouldn't necessarily need any additional instruction. But if you find that, if there is a need for that, that's something that we could assist in developing some, just one-page technical assistance materials that you could share. But it does have instructions right on the back of that tiny little packet. Perfect.
Robin had another question. Do we know if deterra can be used for illicit substances?
It's a good question. I don't know the answer off the top of my head.
I know it can be used for vaping, and that, because I had that conversation with different smoking patches and things like that can be used for that, but that's all I know.
Perfect. Yeah, we
can
could
find out.
Yep. I think in our meeting follow-up email, we try to get those out as soon as we can after the meeting, but when we follow up, we can include what we have as responses to each of these questions. Perfect. I will jump into the next topic. So this is just regarding buprenorphine prescribing and the ability for prescribers to prescribe buprenorphine without completing the data waiver training. And so there was the federal law change that occurred, well, it's over a year ago already now. And so I don't know if many of you have already looked into that or not. So I'd rather just give a little recap on what that change did and how that made medication-assisted treatment more accessible for individuals. So if this is something you already know about, please feel free to jump in and you can help me explain it. If not, then hopefully this is something that you could use to help expand medication-assisted treatment in your community. So what happened is there was a federal law change to allow prescribers, so not only physicians, but also what's identified as the mid-level prescribers, so physician assistants, nurse practitioners, to be able to prescribe buprenorphine for up to 30 patients without completing the data waiver training. So the way that this works is the individuals just need to register with the DEA as a buprenorphine prescriber, but there is no requirement to complete the actual data waiver training. So the biggest barrier is not in place for somebody to get started and carry a small patient load for buprenorphine prescribing. The limitation is the number of patients that they can take on. So that is what the issue is. Biggest barrier, Michael commented, the biggest barrier is having to get a new DEA number. So yeah, that could potentially still be a barrier for prescribers. I just want to share really quickly, and we will send out the link. This. Just sharing my screen, my apologies. All right, so SAMHSA has the link to get into the buprenorphine registration. So for example, this is where the prescriber would just complete the simple application. So as you can see, this is where they would be able to just go on, register with the DEA, and then once they get that new DEA number, they would be able to prescribe buprenorphine for up to 30 patients. So again, the biggest thing that this does is it makes it easier for a prescriber to prescribe Suboxone or buprenorphine without having to go through the training that it was previously required. There still is the advantage of going through, doing that training and being able to take on a higher patient load. But this does make it a little more accessible to find out, to have a prescriber offer these services. So I just want to bring that up in case, you do have any prescribers in your community who could potentially get on board with doing this. There is no longer that training commitment that is needed. So that would be the biggest selling point that just would want to make sure you all are aware of. Any questions about that? Also, the SAMHSA has put out a training and technical. So the next thing on the agenda, SAMHSA has put out a training and technical assistance request on their SPARS website for agencies that are collecting GIPRA. So if you are an agency, or if you are working with an agency who is collecting GIPRAs and they have any concerns about the practice, the process, how they're making it work, how they're doing follow-ups, there is the ability to request training and technical assistance specifically from SAMHSA on that. And so we can put that link in our follow-up email as well. So just want to let you know, even if you're not doing anything with GIPRA, this next grant cycle, if that's something you're interested in expanding into, there is some training and technical assistance opportunities there. And that does lead to, the next SOR grant has not been posted yet on SAMHSA's website. We received a notification it was going to be posted the end of last week. That never happened, so we know that it will be posted and we will be applying for it. So we don't have any concerns about that. It's just, it hasn't been posted yet. So just a quick update there, and we will keep you all in the loop as well when the next SOR grant comes out. And then the final thing I was going to bring up is that the behavioral health conference that our division hosts every year, we have just announced this week that we will be having our behavioral health conference that we now do in collaboration with Child and Family Services. Will be October 11th 12th, and 13th in Fargo this year. And so just want to let you know that in case that's something you could help us share. We don't have the agenda set and the speakers set yet at this point, but we do have the dates and location. So just wanted to share that that is something that we'll have. So again, October 11th, 12th, and 13th in Fargo, and there will be in-person and virtual options for attendance.
And can you explain like when Recovery Reinvented is? Because they normally coincide together, but this time it's a little different.
Yes, and so this year, Recovery Reinvented will be not the same week. So the Office of Recovery Reinvented will be doing their day Recovery Reinvented event at a separate time. So it will not be the same week. I know that it will be located in Eastern North Dakota somewhere. So I know that they're going to change where they're offering it, not just in Bismarck. So I know they're going to go out east and Grand Forks. Thank you, Michael. Oh, he's on top of it. And then I don't know if they have a date yet, but I know it's not going to be the same date. I believe it's going to be sometime in September, so it will be different. And then I see we got a question in from Katie. Haven't read it yet though. So the question is, MAT for inmates, folks in corrections, do we know anything about methadone and transitioning someone to something else like Suboxone? We don't have a local access point for methadone, but we do have access to Suboxone, having folks come in engaged in methadone treatment, and we're not currently able to accommodate that. So that is, yeah, that's a really great point. I will say that we do have a bigger issue around Suboxone in jail settings in, most communities. So that is currently, it's a statewide issue. And yeah, I guess at this point, I'll say, Katie, I'm really glad that you brought that up, that it's an issue in your community as well. It is something that we definitely have on our radar, and we know that we need to work on. So, yeah, there's no quick and immediate solutions to that right now.
Right. And Michael had a really good comment in the chat. It said coordinate with the methadone treatment provider to come up with a transition plan. They're usually pretty good about it. So that's good. Thanks, Michael. Oh, and then Robin had a comment about National Fentanyl Awareness Day is on May 10th. That also brings us up. Another update is that we are promoting the National Prevention Week coming up next week. So if you haven't gone to our website, we put an online toolkit on there for National Prevention Week efforts. And we have some example social media posts, some, like an example newsletter insert, and some things like that that you can check out. And we're just encouraging you to promote National Prevention Week locally with your community and your community partners. So you guys should have all received those emails, a couple of them by now. But yes, thanks, Robin. Oh, and then like part of that National Prevention Week is National Prevention Day by SAMHSA. So SAMHSA is putting out the National Prevention Day and a couple other events happening after that. National Prevention Day is on May 9th. That's Monday. So it's a free virtual event. So make sure you register for it. And then you'll get the login information. But that's a really good kickoff to Prevention Week. And they usually have a lot of good guest speakers and things like that, good topics that they're covering. So just make sure you register for that. That looks like it's going to be a really good day. So that's what I have. James or Katie, anything else on that?
Tom, this is Bev again. Will that be recorded? Do you know?
I want to say yes. I think I saw something on there when I registered that it was going to be recorded, but I'm not 100% sure.
Okay,
I would
have
say
another conflict.
Yeah, I would say register for it, and then I think they send you the correspondence related to that Prevention Day. So if they put out the recording, then you'll get notice that the recording was put out. All right, well, good. That kind of covers all of our state updates, unless somebody has any more questions. But then we'll kind of get to the grantees now. We don't have a whole lot of time. We only have about 40 minutes. So we'll kind of keep this short and sweet. If anybody has any updates they would like to share.
Can I?
Yeah.
Oh, can I ask a state question? Sorry,
Yeah, go ahead.
about not asking sooner. The opioid settlement money, I was at a conference last week, or 2 weeks ago in Atlanta, and there were a ton of sessions on the opioid settlement, and I was surprised to find out the opioid settlement dollars were already going to be starting to come out in May. When is the state getting them? Is there a plan for them?
Great question. So I'll take that. So the way that the opioid settlement dollars are coming into North Dakota is through the Attorney General's office. The end of last year, we had begun, DHS had begun to have some discussion with the Attorney General on how we would use those dollars, and some ideas. One of the things that actually came up, and Katie was, not the DHS Katie Beyer. We were looking at how to start a pilot program to get MAT into the jail system. So initially we were looking at using the Burley Morton County Correction Center as a pilot project, so that it could be for inducting individuals onto medications for opioid use disorder. The current Attorney General, passed away, which I'm sure most of you have seen. There has been a change in the Attorney General, and we haven't gotten things back on track, I guess you could say. But I know that there is interest in having the dollars work towards that correction setting. But we, in some ways, are at a restart point. So we know that up to 85% of the dollars will be, I don't want to say siphoned to, but given to Department of Human Services to administer the dollars. I know that, North Dakota will be receiving the dollars, but we will probably be looking at, just with some of the changes in circumstance, getting together an advisory board to help us in guiding how to use those dollars. So that will probably be the next steps for North Dakota on the settlement funds.
How much is it roughly, James? Do we know?
So I think the news article was 40 some million. So
Wow.
That's what I had heard.
Yeah.
That is a
Can
lot.
I nominate myself to be on that advisory committee or suggest myself?
You sure can. We have gotten a lot of inquiries. So I have no issue with you bringing that up. And yes, we do want to make sure there's representation from individuals who know what's going on in the state and where there are needs. But I think, there just have been some changes in our government landscape, and how this is going to play out is not how we originally were hoping.
Well, if I can get a seat at the table, I will be a very passionate supporter, I guess, of using it well, of being a good steward of the resources entrusted to us.
Yeah, and one of the great things about these dollars is it doesn't have the strings attached that most of our funding does. So these are not, there's not some of the barriers of like GIPRA reporting. There's not some of those, SAMHSA specific barriers. It can be used for the full continuum of care. There isn't the limitations on, a lot like the SOR. It could be prevention, it could be treatment, it could be recovery. So there's just a lot of opportunity with these dollars, and we want to make sure that it supports, our state efforts in the current opioid crisis right now.
There's going to be a lot of hands out.
Yeah. You want to read the question by Katie in the comments, James?
Yeah, is there a plan for meaningful inclusion of folks who were impacted or who would be served by programs that come of the dollars? And so I would say it's too early to speak to that right now, Katie, but I appreciate your thoughts on making sure that, you know, that population is represented as well.
Any other questions that you guys have? All right. Okay, so let's move into the grantee work. So if anybody has anything that they would like to share, any successes, any barriers, any comments, anything like that, we have roughly about 30 minutes left. So Michael's raising his hand, so we'll let Michael go first.
I'll actually turn my camera on this time. So I just wanted to share with everybody that we are in Grand Forks through work of an intern that I had. We started a naloxone leave behind program with our fire department. So we thought that the fire department was the best candidate for this program because when they're responding to medical calls, they're the ones that don't have an immediate responsibility past the initial stabilization. So they have a little bit of extra time on the scene after an individual has been transported. So the way the program works is if they find an indication for an individual to receive naloxone, they have 2 boxes of naloxone on each of their, each of their trucks that respond to medical calls. And they can provide the training to the to an individual that is remaining on scene that is interested in receiving the naloxone, and then leave up to 2 boxes of naloxone for that individual. The criteria would be evidence of prescription or illicit opioid use that is a cause for any concern, or an individual, or responding to an overdose. And there has to be somebody left behind on scene to receive the training, and they have to be willing to accept the training. The intention behind this program is to add to the toolbox of our first responders to help decrease the chance that individuals will have an overdose, again, reaching a level that it requires an emergency response. And then also, as a way to help support family members and other individuals post-overdose. One of the best, since the program started at the beginning of March, it's been used 4 times. The best story in that was there was the story that kind of paints the picture of why we started the program, I guess, not the best story, was an individual experienced an opioid overdose. The spouse that was on scene with the individual had no idea that they were using opioids illicitly, and was very distraught. And so the firefighters that were on scene after the individual was transported were able to provide this, provide naloxone to, to the spouse that was remaining on scene, and help support that individual through having something in their toolkit that they could provide to them, in a meaningful manner. So that's a really good example of this as a burnout reduction tool, by increasing the amount of tools that you have available, and also as a way to, provide really good service to the, the individuals that we serve. The way we got buy-in from our fire department, the way that they were able to kind of rationalize operating the program, which I thought was a really good way of, of kind of getting that buy-in with the fire department, is they recognize that they're in the life-saving business. And they aren't necessarily in the judgment business. They don't, they don't make snap judgments on, any other situation where they're expected to respond to on how they're going to, how they're going to prevent the next one. So I really like that kind of narrative that they've been using, and it's really gone well with them. We aren't using any type of, we aren't requiring them to provide this. We're just simply giving this as a tool into the toolbox, for the firefighters who, want to have that available to them. And then just the other thing I wanted to mention, within our certain service program, this year we've had 350 doses of naloxone given out. We've had 59 clients that we've served in the first 4 months of this year, and we've had 72 reported opioid overdose reversals. And then finally, we're doing some exploration into the certified community behavioral health center concept. We have a program just across the river, literally 2 miles from us, Aluma, or Northwestern Mental Health Center, who was one of the pilot programs in the country for the certified community behavioral health center concept. And part of that concept includes a pretty significant component related to providing outpatient substance use disorder treatment as well as MAT. And so that would be, both of those would be a great opportunity for us to integrate it well into mental health services and provide a really good spectrum of care. So we've been actively coordinating with some individuals in the legislature to try and elevate that idea and make sure that if it does come to North Dakota, that there would be a way for it to be, for reimbursement to be provided. So that's what we've been doing.
That's awesome. Thanks, Michael. 72 overdose reversals in 4 months.
Yeah, and that's self-reported by clients.
Oh, that's really good. Anybody else have any updates or anything they want to discuss? You can raise your hand or you can just jump right in. I see some hands up. Sue, you have your hand up?
Yep, I do. I just want to say the One RX program was at the pharmacy conference last month. And the pharmacies they spoke to in the Bismarck area reached out to us for the Narcan. And so we have 8 new pharmacies that we partnered with to provide opioid education kits, which it has Narcan and the Deuterabagan. And they were really excited to partner. So that just was fabulous. So just want to say what a great collaboration it's been. And then we have, we did a take back event with University of Mary, and we're planning a take back event with Burleigh County Senior Center, May 25th.
That's awesome. Yeah, I saw the post on Facebook on the University of Mary one. That was pretty cool. Awesome. Thank you, Sue. Any questions for Sue? All right, Oliver, I see that your hand is up. If you want to go next.
Hello, everyone. Thanks. And it's great to hear Sue's comment about the Narcan partnership with the pharmacies. And yes, we were out at the convention. We tried to get the word out. And so thank you, Sue, for mentioning that. And also we have been doing some outreach efforts to the other local public health units, continuation, trying to improve that linkage. And we're grateful to the local public health units for sharing their Narcan supply with the pharmacies to get it into the high risk for overdose patients and out into the community. So I applaud everyone that has been a part of that. Secondly, we had looked at some data, and we've noticed that pharmacists do an excellent job at discussing risks of overdose and getting Narcan in the hands of individuals, discussing signs and symptoms of opioid overdose. However, they're not as comfortable discussing opioid misuse and opioid use disorder. So from the data we've collected, we've actually have a little bit of a initiative or educational outreach where we've tweaked some resources we'll be distributing to pharmacies that have talking points and discussion topics with patients to improve that conversation of what misuse is and what opioid use disorder is. And then there was a question on the Deuterabags and whether they could be used for illicit substances. And I did just a quick lit search and looked at the manufacturer's website. For what it's worth, of course, the manufacturer of Deutera does not say that it can be used for illicit opioids. It only lists prescription opioids. But with regard to the mechanism by which it works to deactivate medications, it states any and all opioids will be deactivated with use of the deter bag. So there should be no reason that illicit substances cannot be used to deactivate it, just as prescription medications. And the only things that cannot be deactivated with the deter bag are antacids, iron supplements, heavy metals, things of that nature. So hope that helps.
Awesome. Thank you, Oliver. Does anybody have any questions?
Yeah, thanks for answering that, Oliver.
It's good to know. I see that Karen has her hand up. If you want to go next, Karen.
Yes, I just wanted to mention, we've been getting calls from people in the community because they've heard that we have Narcan, and so then they're asking to, get some. And so I've just made it a point that if they do, they have to come in and meet with me so we can discuss the appropriate use for it, and that EMS needs to be called if they're using it, and cover all of those things with them so that they know too what needs to be done. So we don't judge if it's illicit use or prescribed use. We just go over what needs to be done. I will say that we've had MOUs in place with pharmacies. And for us, one of the things that I found in trying to, had somebody from the community call about it. And so I referred them to one of the pharmacies to get it. Well, when I called and talked to that pharmacy, they had forgotten or did not remember that we had an MOU. And so if they don't use it often enough, or aren't asked often enough, they sometimes forget. So just a reminder, even to me, that I need to kind of follow up with them periodically and remind them that it's still in place and we can do this, and that's going on. So that was basically a barrier for me, because I thought, okay, well, we've got this in place. This should not be a problem, right? The other thing, I just wanted to thank Katie for following up on my question. I had gotten a question from the correctional facilities about being able to use, the grant to assist in paying for an iPad so that those incarcerated could access, alcohol, drug evaluations and treatment. And so we are working with corrections here in the Southwest to see how many they're wanting, and get, reports from them, how often they're being used, that kind of thing. So thank you for that. That's going to be very helpful in our community, to be able to do that through corrections. And we do have a good working relationship with corrections in the Southwest area. Kelly Krieg is just wonderful to work with, and Kara Simon. So we're grateful for that. So I think that's all I have.
Awesome. Thanks, Karen. Yeah, if anybody has any questions about how they're using the iPads and stuff like that, feel free to ask and talk to Karen, talk to Katie. Any questions for Karen? If not, does anybody else have anything they want to share?
This is Miranda from Richland County. Can you
Hey,
hear me?
Miranda.
Hi. I just wanted to share, so we've kind of been doing some work with our local clinics here in Wapaton. We have Essentia Health and Sanford Health, and they're both looking more into like prescribing MAT and getting providers trained on that. And like Sanford, they have their own grant, and then Essentia is through Duluth, their area already does it, so they're training other areas. So I just wanted to share that. I don't know if any one else has like smaller clinics in their area. They might want to check with them to see if they're doing the same things. So we should have providers here in Wapaton who can do buprenorphine. So that's exciting that we can refer people there if we need to. So that's kind of the main thing going on here.
Awesome. Thank you. Anybody else have questions or comments? Trying to have a quiet group today. It's been kind of a quiet week for everybody, I think.
This is Bev, and I've been doing a lot with those doTERRA bags. Man, I've been able to get a lot of them out in the community. I put together those parent packets, and I found lots of places that you can use them. We had a mental health summit at the school last week, and I had a display booth there, and I had some doTERRA bags in there, and I filled those parent packets with lots of parents' lead information. It's just a nice way to get that information out, and it's not very threatening for the parents. You can just hand them out with some education. People are looking for opportunities to do so.
That's awesome. Thanks, Bev. Yeah, that brings up another point. We're in the process of trying to evaluate the Parents Lead program. So you guys have received a few of my emails about that Parents Lead evaluation. So please make sure to talk to your school administrators. It's going out to, I believe, principals and superintendents in your schools, as well as your school counselors. So please talk to them, let them know that this survey is legit and to forward it on to the parents. We have some really good representation in certain communities because we're asking for the zip codes. And it's a lot of our smaller communities. So you can see that our smaller communities are kind of forwarding it out, but we need to get just a little bit more. We're at around 260 respondents, and we really like to increase that number. So please, if you have time, contact your school administrators, let them know about the survey. Also, feel free to share it with your partners. Ask them to fill it out if they're a parent or caregiver. That would really help us out in guiding the program and helping us make decisions about the program. I'll send out another reminder email on it today, just so you guys are aware.
There'll be a link. Is there a link in that? Will you send a link in that email?
I sure will. Yep.
Okay.
This is Jody. Can you hear me?
Sure can, Jody. Go ahead.
I just wanted to make note, we've created quite a partnership now with our tribal communities as well. So just being able to provide Narcan trainings has been huge for us lately. Just in the month of April, I had trained over like about 40 people. That was mostly professionals and tribal entities. We've had real like high demand of requesting for Narcan. And so I felt like just through March and April, we went through a lot of it, whether it was replacing or just trying to give it to new locations. I even actually had to go to our Dunseat community and train some like a clinic situation where I was training providers and stuff like that, which I found to be a little out of my comfort zone, but it's been real good for creating partnerships. And with doing the Narcan trainings, I also try to promote the harm reduction services, knowing that that's going to come probably sooner than I'm expecting. And so just giving a shout out to Michael, when we were in Atlanta for that training, just getting some ideas from him and things like that. So definitely know that as a state team that I'm going to be coming after with tons of questions and guidance on how to maybe go that route next. It's
Awesome.
definitely a need in our community.
Absolutely. Yes, thanks, Jody. And that another update. So we put out our request for proposal to all of for vendors to actually complete a survey on the tribal reservations. And what it will be is about adult substance use, and then also, the readiness survey, the perception survey. So it's a combination of both of those surveys. This will be the first time that our tribal reservations have data that's specific to their community on adult substance use. Because right now, in the way that they're guiding their efforts, is there's not a whole lot of data to show what substances are being used by the adults. So this is something that we just put an RFP for. It closes here in a week or two, and we're really hoping to get started on the data collection in the process of collecting that data on our tribal nations. So we're really excited about that. We would be one of the only states in the country to do this. And we have really good tribal partnerships. Like Jody said, we're really getting good tribal partnerships, and we really hope to see this successful. So I saw a comment from Deb Hansen. Deb, if you want to provide your email address, or anybody who wants to provide their email address, please do, and we'll get you on our contacts list to send out information so that you can get the email updates and things like that. So thanks, Deb. I just saw that on there. Any other comments or questions? Anybody have any updates or successes they'd like to share.
So I don't know if you guys have been watching the chat. James and I have been talking about naloxone formulations. So there's 2 new naloxone formulations. One is a generic of the Narcan nasal spray. So it's the same 4 milligrams and 0.1 mLs, and it looks almost exactly like Narcan nasal spray. The box looks very similar, things like that. The cost is relatively similar, actually, at the price that we pay for Narcan. It's cheaper for us like to buy Narcan nasal spray instead of the generic. But then there's also a new generic called Kloxxado, and that's a large dose of Narcan. I would just advocate probably against pursuing Kloxxado unless there's some sort of an amazingly good price or something like that, because it is a very large dose of naloxone that is probably more than is needed to reverse almost any overdose. And there's also a tendency when you have 2 Narcan nasal spray devices in each package to quickly, time kind of dilates when you're in an emergency. And so you probably end up giving 8 milligrams of Narcan anyway within the first 2 minutes, because they aren't, responding to you as fast as you would want, without giving it enough time for it to work. So, I'd advocate against the Kloxxado. It's probably not worth the extra price, the extra confusion compared to the Narcan nasal spray.
Gotcha. Yeah, and I appreciate you clarifying that for us. I thought you were saying to get the 8 milligrams, so thank you. I guess that does lead to we actually got a reduction in price on our Narcan, which I thought everything was going up. So apparently not Narcan. So that has been very helpful for us. But we are actually in the process of still exploring another vendor who might supply us with Narcan here at the state. One of the advantages with this other vendor is that we would be able to register each of the public health units as a site. And so when we would place orders, we would be able to identify which site we want the order shipped to. So the advantage is communities that get a lot of Narcan from us, we could place the order, make the purchase, and have it shipped directly to your public health unit. So essentially cutting out, using us, our shipments coming to the Capitol, Stacy, who is amazing on our team, but, getting those shipments then shipped from Bismarck to wherever, you're located at, we'd be able to cut out that step, which would save us some shipping costs, and then would also, make things work a little more quickly. So that's one of the things that we're looking into. And again, there's just some of the procurement stuff of getting them registered as a vendor in North Dakota. And so I can't give you an exact date on when that's going to go through, but that is something we're working on. Go ahead, Tom. I saw you on
mute. Per Robin's comment, she can pick it up for $67.50 a box. I believe that's about where our new price is going to be with this.
That's
right?
exactly what our last order was. So
Yes,
so just something for you to keep in mind that is what we are getting as a state rate right now. So yeah.
And should Robin be getting Narcan through you guys if she's buying it with grant dollars? Would she be better off just buying or getting it from you without it reducing her grant amount?
It's a good question. Do we have a preference? I don't even know if we have a preference.
Well,
actually, James and I did chat about this when I was applying for the SOR grant, and we decided that because of the amount that we purchased, it was a lot easier and better for everyone if we just took care of that on our end with our grant dollars. And I think we were given enough that we'll be able to buy what is needed. And also just a thanks to all of the health units that are donating their soon to expire or expired Narcan to us as well.
Yep, that makes sense. Thanks, Robin.
Sorry to inject myself in the middle of that. I just am very appreciative of the availability of Narcan for you guys.
Yep, no worries.
Absolutely. One of the other things I guess I'll bring up, and this is more future oriented, so didn't necessarily include it because we figured we'd have more solid updates for the next SOR meeting. So we probably still will have more updates, but we are looking into getting fentanyl test strips available. We haven't talked to any partners about this yet, so I just want to be really clear that you know, this is really at an infancy stage, but we are hoping to get things to keep moving where we can start talking to partners. What we've done is we've gathered some of the evidence-based resources that SAMHSA has. We've gathered some information from the state of Utah who is doing this, and also the city of Chicago. Our team was able to meet with Chicago on how they have implemented the utilization of fentanyl test strips in their community. But essentially, what it is the test strips to test the residue of a substance to see if fentanyl is present. And so this would be, you know, our data is starting to point to in the state are involving fentanyl, whether individuals know that or not. But what we would look at doing is a full program where we would get help with the dissemination of these test strips from, you know, stakeholders who are touching those at risk of a fentanyl overdose. And then there's an aspect of educating people how to use the test strips and then what to do if you do test positive. So this is where, you know, the best practice really educates on how to use in a manner that would mitigate the risk of an overdose. So even if somebody knows that there is fentanyl present in the substance that they're about to use, doesn't mean they're just going to throw it away. So there is the knowledge on education piece on how do you use it, what are some of the steps you can take to be safe to avoid an overdose and mitigate that risk. So that Katie said that they are offering the test strips and training to syringe service participants now. Awesome. Wow. Well, maybe that's a question for, I don't know, Michael in Grand Forks. Have you guys gotten into that at all? Or Fargo? So other areas where there are syringe service programs, have you gotten into that yet? Okay.
So we offer them. Oh, you can go ahead, Robin.
Oh, okay. I was just going to say, we've had them almost since we first opened in April of 2018. And we're getting them, they actually have lowered in price as well. They started out at $1, now they're at 82 cents. We purchased them from NASN, the North American Syringe Exchange Network. And yes, we provide instructions on how to use them as well as education on what to do if they test positive. We've also followed up with our participants on how they've used them and what actions they have taken after they have tested positive. And the anecdotal information that we've received from our participants is extremely positive and definitely makes the case for us to continue to offer them. But we would love to have help on purchasing them. So if that is something that the state could assist with in the future, we would take all the help we could get.
Awesome. Yeah. And so we are able to use the SOR grant to purchase the fentanyl test strips. And I think it'd be pretty easy to say, you know, if you need a way for us to be the ones to purchase them for you, that we could continue that discussion. And then I think if there are some ways that we could further support you in, you know, if it's having a training video that is, you know, outlining this, that maybe could be shown where it's being distributed, or maybe there's other areas that we should look into. You know, if the syringe service programs are already providing them, we can maybe support you in some other ways of the purchasing, if there's resources you need, and then we could look at other dissemination points as well. So maybe this is a whole nother discussion that we should dive into.
I was just going to add, our experience has been with fentanyl test strips is we certainly offer them, and we certainly have people who accept them, but we don't actually give out a ton of them. You know, the individuals who in our area who primarily use opioids just have an understanding that essentially everything is going to be positive for fentanyl, and so a lot of them don't take the fentanyl test strips. But you know, we certainly still offer them as a an opportunity for a lot of our clients, but we just don't get really good feedback on on their effectiveness because everything's positive now that they would otherwise be testing for.
So ours are typically given out to our meth, to folks that use meth, and that makes up about 92% of our participants at our syringe services program. They report 30-day meth use. So we give out the strips primarily to those folks because they're not expecting the fentanyl and not really understanding its effects like the opioid users would. So that's primarily who is taking the strips at our syringe services program. And I also just wanted to comment too on the para law. The test strips are considered paraphernalia. However, I did talk to our county's drug task force and asked them about this, and they were unaware that it was considered para, and they said that they kind of laughed and thought it was kind of ridiculous that it even would be considered para, because they said unless there is residue or substance directly on those strips, they couldn't charge anyway. So if someone was just carrying around a strip, that was unused, that was in its package, it wouldn't be, subject to the para law. So I think, even though it is in the law, in the letter of the law, I don't know that it's as big of a concern as, some may think. That's just been our experience.
Yeah, and we noticed that as well. And I think, I should be careful how I say this, but we were looking more at let's do what's best for people and ask for forgiveness instead of permission, kind of see. But we want to make sure, wherever we would be able to support, if you're already doing that, that makes it, easy to support you. But if there's other entities that we could get to distribute these, then we might have to look a little bit more about our approach around that.
Katie had a really good comment in the comment section with the testing kits and stuff like that. So please read that. It gives a good idea how to use them. Looks like Michael provided some information too, so.
I've never had an issue with a client like getting in trouble for having fentanyl test strips. I just wanted to make sure that we were aware of what the law says on it. And I agree that the law as written doesn't make a ton of sense. It was based off of a model DEA law from the 1970s. Another thing I learned all about at this conference a couple weeks ago.
Sounds like a good conference. I don't know why they would have the testing strips as that, but very interesting. All right, we're nearing the end here, you guys. So any final comments, thoughts, questions?
Do you have any idea what the next year's grant goals will be, or long range planning so we should kind of plan ahead?
What do you, well, I mean, as far as funding, there's not a reduction in the overall federal budget for SOR, so we're anticipating that the dollars would not go down. I mean, we won't know for sure until it's out there, but we are really aligning to the current White House, or I guess you could say they're aligning to our state strategies around opioids, which are prevention of misuse and opioid use disorder, increasing access for treatment, increasing recovery supports, and then increasing the availability of harm reduction. So those 4 points are our opioid strategy right now. So I don't know if that's what you were asking or not.
Yes, thanks.
Do you anticipate a similar application for continuation in the coming year?
Yes. And I would say, you know, it'd be nice to increase some of the treatment access goals that we have. I know there's less communities. We're grateful for any of the work that you're willing to do and take on. So first of all, thank you. I think we could use some additional support in increasing access to treatment in the state. So maybe just something to think about for your local community, if that's something you think you could assist with or not.
All right, any other questions? Yeah, hopefully we hear back soon on what's going to happen with the SOR. So, and we'll communicate as quickly as possible once we know. All right, a little bit past our time, so I just want to say thank you to everybody. Thanks for all that you guys do. If you have any questions or if you need any technical assistance, feel free to email us, let us know. We're here for you. So, all right, you guys take care. Have a happy Wednesday.
Thank you.
Yep. Bye, everyone.
Thank you all.